All right, emesis means to vomit. Emesis is a suffix. Emesis is also a medical word all by itself. So hyperemesis, someone is excessively vomiting, but I think you'll agree. One set of regurgitation sounds excessive to me. Entero, intestines, we've had that already. So intestines, usually small intestines, but not always. But in enteritis, it is the small intestine that has the inflammation. Esophago, the esophagus, the muscular tube from the back of the throat to the stomach, so esophagitis. Gastro, you know, is stomach. Gingivo, gum, so everybody's heard of gingivitis. Glosso is one word for tongue, so glossitis, inflammation of the tongue. Gluco, glyco, we've had those from chapter 1. Glycogeno, glycogen. Hepato, he patted his liver, so hepatomegaly, an enlargement of the liver. Hernio is a hernia, a swelling protrusion, so hernorrhaphy, surgically suturing. Iesus is one of the cis sisters for abnormal condition. Ilio with an E in the middle, think E for eating. So that's the last part of the small intestine. Do not confuse that with the ileum, that is part of the pelvis, along with the ischium and the pubis. Intestino means intestine. That's going to be anatomy, position, direction, talking about one or both. Jejuno is the jejunum, and that is the second part of the small intestine. Labio, also for lips, so labia would be lips. Laparo, abdominal wall, so laparoscopy, the process of viewing with the lighted instrument, the abdominal wall. Linguos, the other one for tongue, so someone's bilingual, we know they speak 2 languages. They have 2 tongues. Lithostone, I have a stone in my mouth, so I have a lisp. Calculus is a $5 word. Lithogenesis, the formation of these stones. Lysis is a suffix. Lysis is also a word by itself. Lytic is the adjective form, so lysis, destruction, dissolution, breaking down, setting free. So lipolysis, we're breaking down fat. Mandible, you know, is the only movable bone in the skull, it's the lower jaw, mandibular. Naso, nose, for position, direction, anatomy. Odonto, teeth, you know, you go to an orthodontist to straighten your teeth. Oral is mouth, use that for anatomy, position, direction. Palato is a palate, that's that plate, the roof of your mouth. Pancreato, you can imagine that's the pancreas. And pepso, pepsia, drink a Pepsi if you're having problems with digestion. So dyspepsia is indigestion. So dysphonia is hoarseness, dyspepsia is indigestion. Through, percutaneous, through the skin. Peri, around, perianal, around or surrounding the anus. Peritoneo, we've had that before back in chapter 4. Very important structure, the peritoneum, literally stretching around. So that's the membrane inside the abdominal wall. Phagophagia, to eat, swallow, devour. So polyphagia, someone's eating excessively. Pharyngo is the throat. Plakia is a plate. So leukoplakia, you can imagine they're white. Plastoformation, so stomatoplasty, surgical repair of the mouth. Polypo is polyps. These are these little small stalk-like growths, kind of mushroomy in a way. So polyposis, somebody has polyps in their colon. Procto is straight. A proctor during a test keeps you straight. Also, procto means anus and or rectum, so you would go to a proctologist. You've heard of that. Prandial is talking about a meal, so postprandial, you take your medicines after you eat. Pyloro is the pylorus. Now that's a ring of muscle. Ring of muscle is a sphincter. that regulates the emptying of the stomach contents into the duodenum or duodenum. Recto is the rectum. It is the straight part of the colon in between the sigmoid and the anus. So a rectocele, a herniation, protrusion, swelling of the rectum. Scopoview, pharyngoscope, an instrument used to view the throat. Sialo is a salivary gland, saliva. So sialogram is going to be that record, that x-ray of that gland. Sigmoido, literally resembling S. Sigma is the Greek word for the letter S. So the sigmoid colon is S-shaped. Spasms, you know, are twitchings, involuntary contraction. And a gastrospasm, you know which structure is spasming there. Spleno, medical combining form, 1E, English word, 2E, so splenomegaly, enlargement of the spleen. Steato is fat, so steatorrhea, someone's got diarrhea that's made up of a lot of fat. You might have heard of Ally or Olestra. If someone eats too much fat and they're taking these medications, they might suffer from steatorrhea. Stomatostomo is mouth, so stomatitis, stuff that tomato in your mouth. Tresia is a perforation. So atresia, you know, there was supposed to be a hole and there's not one. Uvula, I just like this word. You see in the cartoons this little punching bag thing hanging down in the back of the throat. That's the uvula. The uvula. Now, some terms to know. Digestion, make sure you know this word, is the process of altering the chemical and physical composition of food. Mastication, $5 word for chewing. Deglutition, $5 word for swallowing. So masticate and then deglutit, whatever. So mastication, then deglutition. Bolus is a ball, a bite. So in this case, it's talking about the bites of food that are mixed with saliva. Chyme is time for chyme. It's time for chyme. Once that bolus boli has gone through the process of mastication and deglutition, it's going to be swallowed, and then when it mixes with the digestive juices in the stomach, it becomes chyme. So it's time for chyme. Sphincter is a valve or muscular ring that is supposed to prevent backflow. Someone might have heartburn because one of those sphincters in the stomach is not preventing the backflow. Stoma is an opening. Ulcers, now we had ulcers in the integumentary system. In this, and again, it is a lesion of epithelial tissue, but in this case of the stomach, the duodenum, ulcer. Epithelial tissue. Absorption, as the name implies, we are absorbing, breaking down the food as it moves from the intestine into the blood and the lymph. Peristalsis, these are those wave-like motions of the intestines to move the food along. Also how food gets down the esophagus. So without peristalsis, astronauts could not eat or defecate in outer space. So peristalsis, that wave-like motion. Gavage versus lavage. Gavage is the garbage that someone is forced to do when eat when they're on a food tube. So gavage, the procedure in which liquids or semi-liquid food is introduced into the stomach. Lavage, think of lather, lather. So that's the process of irrigating or washing out an organ for therapeutic purposes. Now, don't confuse lavage with debridement or debridement, not debridement. So lavage is therapeutic. We're just doing it because we think it's healthy. Debridement, there's debris contaminating our tissue. Singulars to plurals. Papilla, papillae. Gingiva, gingivae. Appendix, appendices. So this would be a good place to stop, and we'll pick up in part 2.